One of the important things when we have families, mums and their babies, and mum maybe is feeling a little bit depressed, is struggling to actually feel at home, we want them to feel as comfortable as possible, but what we find that it's better to be able to listen to people than it is to talk and to tell them what to do and to encourage their parenting. So I think the greatest thing that we can possibly do is to listen, and to listen carefully and attentively, and just encourage this person to talk about their feelings, talk about their past, talk about whatever's important to them. And in that conversation, it's possible then to start to embed some positive thoughts around parenting. When mum is with baby, one of the things that we can do is to provide a commentary really of what's actually happening. Perhaps it's feeding time and you would actually talk about the way in which the baby is looking at mum, and that will encourage mum to actually look at the baby. And then when the baby's a little bit older and starts to look like he or she may be smiling, it's actually observing that and just say, look, that looks like a smile. And all of the time it's actually causing the mum to actually look at the baby and start to really sort of form those important attachments. Obviously when mum is depressed, it's very difficult then for those attachment bonds to be formed easily. There are lots of obstacles, and I think sometimes our role is a very quiet role, is to actually be there and be supportive in the background, to actually be very encouraging, but for that encouragement to be very much grounded in what's happening. So we want to give praise to parents when they do something well, but we want that to be realistic, so that it doesn't sound patronising anyway. So I think the important thing is just to be there, to listen carefully, to be responsive, not necessarily feel the need to be directive, but in everything that we say and everything that we do, to embed good parenting. One of the challenges for us when we're caring for another person is that sometimes we're not sure that they're responding to us, and that can be very frustrating. Sometimes it can feel a little bit rejecting, but it's almost that we've got to have a belief that if we do the right things, if we listen, if we're very patient, if we're caring, if we're very positive, that ultimately that will affect the way in which mum parents baby. And often that can take quite some time. It's not a case of doing that for a week or 2 weeks. It can be a much longer period than that, without a lot coming back from mum. But I suppose my experience has been that eventually there'll be signs that mum is absorbing some of the things that we've actually talked about, some of the things that she said, some of the things that we've listened to, is actually absorbing some of that embedded information that we're providing about good enough parenting. And that's very rewarding when it does happen, but it's just you've got to be prepared to stick in there and actually do what you believe to be right, what's instinctive for you, and not be deterred from doing that, not to be too frustrated, and that really does work in the end.